This is Stockholm, Sweden. A beautiful place with a lot of water, just like Seattle. And it's up north like Seattle, with long, light days in the summer and long, dark nights in the winter. There's just about as many people in Stockholm as there are in Seattle, and Sweden's total population is comparable to the state of Washington's. These are Swedes. They're a lot like us. They love their smartphones, they love coffee, Hollywood blockbusters, Facebook, no big surprises. They work hard to get ahead, and they worry about their kids' future. But unlike us, one thing they don't have to worry about is health insurance. They don't have to think about bronze, silver, or gold, about HSAs or copays or deductibles, percentage coinsurance, out-of-pocket maximums. They don't have to worry about losing their insurance if they lose their jobs. They don't have to worry if the hospital they are rushed to is in their network, and they don't have reimbursement forms to deal with. They don't have to worry if they're covered or not, because everyone here is covered. Just like all the people in France and England and Germany, Spain, Iceland, Norway, Belgium, Italy, Israel. The same goes for people in Japan, South Korea, Singapore, Australia, New Zealand, Canada, and the list goes on. In fact, it's just in Chile, Mexico, Turkey, and the United States, out of 34 industrialized nations, where citizens live without the security and peace of mind of universal health care. Other countries see health care as a human right, a necessary public service like police departments, fire departments, and public schools. Everyone is covered. No one is left out. It saves lives, and it also saves money. You see, we have by far the most expensive healthcare system in the world. More than 17% of our nation's total spending is on healthcare, and that number is going up. That's 50% more than other industrialized nations. The average cost per hospital day in the United States is $4,287, 3 times as much as the second most expensive country, Australia, and 5 or 6 times the cost of a European hospital. The average hospital and physician cost of a hip replacement in the United States is more than $40,000. The same procedure in the UK is less than $12,000, and it's less than $10,000 in Switzerland. And childbirth? The cost of conventional delivery in the United States is double the cost in Switzerland, and nearly 3 times the cost in France and the UK. The same is true for cesarean delivery. The list goes on, driving up the cost of insurance and the out-of-pocket. Now, having the most expensive healthcare system in the world might seem okay if we had the best healthcare results in the world, but we just don't. When it comes to life expectancy, we rank 26th out of 34 industrialized nations. 45,000 deaths of U.S. adults under the age of 65 each year are tied to the lack of health insurance. And looking at infant mortality, we rank 31st, losing infants at a higher rate than 30 other countries. And 42 million people in the United States have no health insurance at all. Here's another way to look at the high cost of health care in the United States. Illness and medical bills are the leading cause of bankruptcy in our country, linked to more than 60% of all bankruptcy cases filed. Every 15 seconds, another American's life is disrupted by medical bankruptcy. And 3/4 of these people had health insurance at the start of their illness. This is not good. It's embarrassing. But we can fix it. We can fix it. Think about it. Up until 1920, women did not have the right to vote. We fixed that. And up until 1965, America had no health care program for the elderly. The cost of their care crushed middle-class families. But we fixed that with Medicare. Now it's time to fix health care for the rest of us, to control costs, improve coverage, and bring peace of mind. The right way to do that is expanded and improved Medicare for all. Medicare is not new. With 50 years of history behind it, it's tried and tested. It provides health care, hospitalization, and doctor visits to Americans 65 and older nationwide. It pays private practice doctors and hospitals for their services, and it does not take a profit. It replaces insurance companies and their complex web of policies with one single payer, Medicare. This reduces complexity, slashes administrative costs, streamlines payments, and works just fine for 50 million senior and disabled Americans. The idea of better Medicare for all is not new. It's been around for years. Physicians for a National Health Program have advocated this since 1987. It's what other countries do. But proposed legislation gets repeatedly sidetracked or ignored by congressional leaders. Things are different now, though. The cost of health care and insurance are getting just too high, rising much faster each year than the salaries of hard-working Americans. The right thing to do would be to act at the national level, passing H.R. 676, Expanded and Improved Medicare for All. But that could take a long time to happen. Luckily, we live in a democracy where individual states can move ahead on their own, and some states are looking to do just that. Organizers point to a provision in the Affordable Care Act that allows states to move forward, after 2017, with federal funds to build statewide programs that replace insurance companies, improving coverage and controlling costs. This is the state of Washington, a beautiful, bountiful place. Up north, innovative. We take a cooperative approach to solving big problems. Organizers here, including the Western Washington chapter of the PNHP, are raising awareness, signing up members, and driving a legislative agenda. They know we could fix this at the national level with expanded and improved Medicare for all. And that's what H.R. 676 is all about. But organizers in Washington believe they'll get there sooner on their own, as one of the first states to set up their own single-payer system. With legislation under review at the state's capital, and a growing list of senators and representatives on board. Spreading the word. This is not a political issue. It's a financial issue, and it affects every single American.
We do it together, never give up.
They have started to imagine citizens of Washington State with the same peace of mind as citizens of virtually every other country in the industrialized world.
We do it together, never give up.
Being able to sleep at night, without worrying that a medical illness could lead to an economic disaster that destroys your family's future.
We do it together. Never give up.
It's time to fix this. Share this video with friends and family and visit pnhp.org to find PNHP chapters and activists in your state.
Do it together. Never give up.
It's time to fix our healthcare system. Let's do it together.
We do